Small vessel vasculitis, they are really rare autoimmune disorders, but they are characterized by an aggressive, rapid onset inflammation that can affect practically any organ. So these are severe diseases. Still, the treatment options are few and associated with significant side effects and even mortality. So it's essential for us to improve the treatment for patients and improve the diagnostics so that we are sure that we're treating the right patients with the right therapies. So what we aim to do is to characterize what's going on in the small vessel vasculitis on a cellular and a molecular level. By increasing our understanding of the basic events taking place, we can figure out better ways to treat patients, both by identifying subgroups of patients that differentiate from each other on a molecular level, but also by identifying novel treatment targets that are more specific for these patients and hopefully associated with less side effects and comorbidities. Because often the patients suffer more from these comorbidities than from the actual disease itself. For example, cardiovascular disease is very common in patients with small vessel vasculitis. And we're now going to study on a large national level in Sweden what factors impact this increased risk in cardiovascular disease. I think it is really important with the international collaborations for these disorders, since they are so rare, but still the patients are heterogeneous. So we need to work together and gather the patients which have been so helpful and willing to participate in the studies to be able to deconstruct the heterogeneity among patients, identify subgroups both on the clinical level but also on the molecular level. And from that we can move on to designing new therapies that are specific for these subgroups of patients. We hope that learning more about the basic mechanisms that lead up to these really severe inflammatory disorders will help us to identify novel treatment targets to improve treatment of patients with these disorders, but also to better categorize or subgroup patients according to shared features among certain patients. As for now, we're pretty good at categorizing according to clinical symptoms, but I think it's more to it than that. I think we need to look at a deeper level, what's going on in the immune system, what immune cells are activated, how are they communicating, and how does that differ between patients. This can help us in identifying novel treatment targets that are more specific for each individual patient, and also to better diagnose the patients. Contributions from organizations like the Vasculitis Foundations have really enabled us to get larger projects started and to enable our larger collaborations within Sweden and Scandinavia. These are rare disorders. We need to work together to find the mechanism behind these disorders and to move forward with treatment and care of patients. So the contributions that we have got, they have really jump-started our project where we're working on the basic mechanisms in disease, and we're even looking at and analyzing samples taken from patients before they even get the disease. So we're now studying what happens in the body with the immune system before the patients even get symptoms.